Fibroids, also called lyomas, are non-cancerous cells or growths that appear in the womb or uterus during a woman's childbearing years. The cause of this isn't well understood. According to a research, it is estimated that 70% to 80% of Black women will develop fibroids in their lifetime. However, not everyone will develop symptoms or will require treatment. How worried should a woman be on fibroids? What are the treatment options and what should I know? Fibroids are not cancerous tumors that grows in the uterus. It is common for women to have fibroids, but then in severe cases, it can affect pregnancy and cause some infertility issues. Research shows that 2 to 12% of pregnant women have fibroids. Hence, it is important for women to understand fibroids and the treatment options. Welcome to the Pregnancy Care Show. My name is Dede, and the show is brought to you by Floradish and Spetonic. On today's episode, we'll be looking at fibroids in pregnancy. We have with us Dr. McCarthy. He has been here before and is here to take us through fibroids in pregnancy. Hello, Dr. McCarthy.
Hello.
Welcome to the Pregnancy Care Show.
Thank you so much for having me again.
Okay, so our viewers really liked our last episode and we would want you to be coming more. I hope we have the chance to be calling upon you anytime.
Yes, we hope so.
Okay, so thank you. We'll go for a short commercial break. When we come back, we'll find out everything fibroids in pregnancy. Welcome back. If you just joined us, it's still the Pregnancy Care Show, and on today's episode, we are looking at fibroids in pregnancy. So, Doc, can you give us a little introduction about yourself?
Right, I'm Dr. Michael McCarthy, a gynecologist obstetrician. I specialize in uterine fibroids, and I encounter uterine fibroids in pregnancy a lot. I am also the CEO of Senel Specialist Family Hospital in Tema, Comte 10 Junction, where we deal with issues for the whole family from a specialist point of view, be it obstetrics, gynecology, pediatrics, urology, general health, physician specialists, and so on. Also having our psychologists, psychiatrists, and diet team to address relevant issues. So in a nutshell, that is what I am.
Okay, so welcome once again. So Senel Specialist Hospital is open. Just walk in and have yourself treated of any medical condition you might suffer or you are suffering from. So Dr. McCarthy, when we say uterine fibroids, what are uterine fibroids?
Well, uterine fibroids are one of the commonest forms of tumors or growths in the uterus.
Okay.
They are not cancers. They are growths that grow, but they don't spread to other places. They kind of stay where they are, and they occupy space within the uterus. They are tumors that come from the muscle part of the uterus. You know, the uterus is generally muscle, blood vessels, and some fibrous tissue, and that helps the pregnancy to stretch out and then push the baby out. And it's the muscle cells that undergo some changes, and then they grow abnormally, forming masses of various sizes, from little as a granite size to as big as a small watermelon, maybe diameter of 14 centimeters or something like that.
That's huge.
So that is huge, and you may have multiples of them, or you may just have one.
Okay. So how common are uterine fibroids?
Extremely common, especially in our population.
Okay.
It is estimated by some research that up to 80% of women, by the time they get to their late 40s, will be diagnosed with uterine fibroids. The good thing is that it's not all these women who have problems or complications from the fibroids.
Okay, so should every woman suffer from uterine fibroids?
No, it's not everybody. In Africa, in Ghana, we have a higher percentage of women. In other populations, they have less. But we just have a higher propensity to get these fibroids.
So how will a woman tell that she has a fibroid? What are the signs and symptoms she would know that she's having a fibroid?
Right. Uterine fibroids give a variety of different signs and symptoms. Most commonly, no sign, no symptom. Okay, it's just about 10 to 20% of people with uterine fibroids who will have significant symptoms from the uterine fibroids. The commonest of these may be changes in the menstrual blood flow, where the blood flow may be increasing, pain during menstruation, or sometimes pain even when there's no menstruation. Situations where there's a mass growing in the lower abdomen and she feels something moving about the abdomen, or she finds a swelling growing in the abdomen. So these are the commonest signs and symptoms that you may have.
So what actually causes fibroids, and do we have type of fibroids?
Right, so the fibroids, the exact cause of fibroids is from a genetic point. Where there are some changes in the genetic makeup of the muscle cells, which then go out of control and then grow abnormally. So they come as growth from the uterus itself, from right inside the uterus, not from outside. And it's genetic, that is already pre-programmed in a way, which of course certain factors which we can discuss would increase the rate of growth of these fibroids.
So how is it diagnosed?
Well, there could be the approach of waiting for symptoms. And so when you have some of the symptoms we described, or sometimes pressure, other symptoms less common like pressure on the bladder, pain during intercourse, or feeling the mass protruding, or irregular spotting, abnormal vaginal discharge, and so on. When you have the symptoms we described and these secondary symptoms I've just given, and you come to the hospital, then we can do a physical examination and try to see whether we can find anything abnormal in the uterus. Tests can be done, and the commonest of these is an ultrasound scan, which is a scan that is done on the uterus to see the exact shape of the uterus, the muscles, the dimensions, and everything. Other things can also be used. Sometimes a hysterosalpingogram or laparoscopy, and also magnetic resonance imaging, MRI, can also be used to diagnose these. But the commonest of these is the physical examination and the ultrasound. But remember, not every mass in the uterus is a uterine fibroid, so we need to look at it very carefully and sometimes use multiple different ways to try to get the answer as to what this mass is.
Okay, so would you advise that women often go to have these examinations done and this ultrasound scan? Should it be frequent for women to be doing, just to know that you are okay, there's no fibroids or anything?
No, when it comes to health checks, you do your health checks. It doesn't need to be frequent. A woman does a health check once a year. And also the types of things we'll look for will be different depending on the age of the woman. If the person is in the late teens, as compared to somebody in mid-30s, the mid-30s one is more likely to have uterine fibroids. And so some of the screenings would involve an ultrasound scan, but not necessarily for every age group. So that is important. So you don't need to come every 3 months looking for fibroids, and they don't also grow that fast. They are rather slow growing for most people, though we have a very fast growing variety. You asked whether there were different types.
Yes.
Well, we noticed that there is the group of women who just have 1, 2, or 3 uterine fibroids in the uterus. And then there is the type that has multiple fibroids. In fact, some have extremely high numbers of fibroids. A nice number that I remember is somebody who had surgery and we removed 99 uterine fibroids. And we've had one with more than 100. So that gives you the scope of how it could be. And we've had some that we've just removed 1 fibroid of moderate size, but creating a lot of problems. So you could have different varieties. There are also rarer varieties, which you don't need to talk about, but that have different kind of characteristics. We can also categorize them by the location in the uterus. That is an important categorization because the location determines some of the symptoms.
Okay.
So if the uterine fibroid is very close to the inner part of the uterus where the menstrual bleeding comes from, then it affects menstrual bleeding patterns. You have more spotting, more increased blood flow, and so on. And those are the ones that may also affect fertility and may also affect pregnancy.
Okay.
And then you have those that may just be in the muscle of the uterus. Depending on the size, if they are more than 5 centimeters, they can create more problems. But if they are smaller, they may not create as many problems as the ones close to the endometrium. And then you have other ones which may occur in other places, like on the outer surface or in the uterine cervix or at the sides of the uterus, or some very close to the urine bladder. So if you have one that's close to the urine bladder, it will be pressing on the bladder all the time. That patient will come with frequency of urination, feeling of incomplete emptying of the bladder, and so on. So the positions in the uterus, as well as the size, would determine some of the symptoms, some of the complications, what we would do. Size alone doesn't mean that your condition is severe. So for example, you have a 2.5 centimeter mass, which is small, located right at the center of the endometrium. That will give you a lot of complications and issues, a lot of pain, a lot of bleeding, and so on. Compared to an 8 centimeter mass that is sitting at the top of the uterus on the outer surface, may probably not give you as many symptoms. So it really depends on what's going on.
On that note, should fibroids be removed?
Well, fibroids will be removed, or fibroids will be treated when they are causing problems.
Okay. So if they are not causing problems, you don't have to take them out.
If they are not causing problems and are not too large, you leave them alone. But you need to understand what is going on. Are you dealing with a 24-year-old, or are you dealing with a 35-year-old who has been trying for pregnancy for a period of time? And so fibroid management needs to be individualized. Okay. We need to understand what is the history, what is going on, what are the fertility plans. If you compare somebody who has no child at all, the treatment will be different from somebody who has had maybe her full family size completed. That treatment may be different. So you need to look at the whole person in totality.
Are fibroids painful?
Fibroids can cause pain. Generally, fibroids are not painful, and that is why they can grow to larger sizes before they are detected, because they'll be growing in there and you're not even feeling anything, you're comfortable, and so on. And then they get to a certain size and then they start causing pain. Pain also occurs more during pregnancy when fibroids undergo some processes which make them more painful.
So if fibroid is not removed, could this cause other complications?
The treatment of fibroid does not only mean removing the fibroids.
Okay.
Sometimes the treatment may be just treating the symptoms like painkillers, pain relief, management of periods, and so on. Sometimes the treatment may involve addressing the excessive bleeding, and this may just be medication.
Okay.
Sometimes it may involve the insertion of an intrauterine device which has some hormone in it, which will help to control the bleeding. Sometimes the treatment may just involve treating the anemia that is caused from excessive bleeding. There are also medications that can be given to address some of the challenges. Surgery, yes, may be an option depending on what we want to achieve and what kind of symptoms are occurring. There is also non-invasive surgical interventions like uterine artery embolization that is available that can address fibroids without actually having a surgical procedure done. So there are many different things that could be done. Yes.
Okay. So can a woman with fibroid get pregnant? If she does the fibroid have any effect on the unborn baby? Or the
Yes. A lot of women with fibroids are actually getting pregnant without having the fibroids removed. Again, you need to individualize and understand the full picture of what is going on. But yes, the fact that one has fibroids doesn't mean that one is infertile. It depends on the location of the fibroids, the kind of complications, and the kind of effect it is having. But we know that uterine fibroids can lead to challenges with fertility. They can reduce fertility. They can even cause infertility. they can affect the early pregnancy and lead to miscarriages and so on. And so you need to look at it really carefully and be sure that you are understanding that particular person's situation and then give the appropriate treatment for it.
Are fibroids preventable?
Well, that's an interesting question. It may not be that fibroids can be prevented entirely because of the genetic component.
Okay.
But one can reduce the negative effects or undesirable effects of fibroids by intervening, not letting them grow too large, intervening when they are starting to cause problems, not waiting for too long before interventions are made. Some of the simple ways that can help the fibroids to grow less quickly are maintaining a healthy body weight, because those who have a higher body weight have faster growing fibroids, and having a healthy diet. Those who have poorer diet with a lot of fat, processed meat and so on are more likely to have faster growing fibroids as compared to those who are having a healthier diet of more water, fruit, vegetable and less fat. Also, those who are engaged in physical exercise have slower growing fibroids. And so these are some of the ways you can intervene to help to reduce the rate of growth of fibroids and therefore the complications. Maybe not necessarily, I will not get fibroids if I'm on this diet. You may still have them, but you may not have fast growing fibroids.
Okay. So can fibroids be mistaken for pregnancy? I have ever heard of a woman who says she's pregnant, but through examination it was realized that it was a fibroid, but she felt the fibroid moving and all that, so she said it was still a pregnancy. So do you have cases like that?
I think I need to follow you on social media because you have some interesting stories, and I'm sure there's some really interesting stories out there.
Yes, a lot of that.
So we will link up to your IG page. You know, because it causes a mass, it could actually visually look like a pregnancy. And so to the casual observer, that may actually look like a pregnancy. Usually to the patient, if she's very objective, it may not look like a pregnancy because she's having excessive bleeding, she's having her periods and so on. But she may feel that her tummy has gotten bigger and there's this mass, clothes are getting tighter, and people are commenting on what is going on. And yes, so you could mistake it as a pregnancy, but then critical questioning, critical examination of what is going on will probably reveal that it's not a pregnancy. However, remember that there could be fibroids and could be pregnancy at the same time. And that may complicate the situation, and it may even be difficult to diagnose the pregnancy if the fibroids are really large and the pregnancy is really small.
A woman with fibroid, does she have pain during sex?
That is one of the symptoms that could occur depending on how the fibroids are located and whether they are undergoing degeneration or not. Yes, pain during intercourse may be a symptom of uterine fibroids. Okay.
So fibroids is not infertility. Fibroids could actually be treated. Even women with fibroids get pregnant. Let's go for a short commercial break. When we come back, we'll find out more on fibroids in pregnancy.
Are you a mother? Are you trying to conceive? Have you had challenges with conception? Do you have a story to share? We are dedicated to helping you solve your problems. Join us on your favorite pregnancy care show and share your experiences with us.
In my first pregnancy, I expected that my body would go through some changes. Yes, and then at the end of the changes, I was expecting to deliver a baby safely.
Remember, sharing is caring, and your experience will encourage and help someone. Contact us on 050-166-1330 or send a message to all our social media platforms at The Pregnancy Care Show, and we will get back to you.
Welcome back. If you just joined us, it's still the Pregnancy Care Show, and we are looking at fibroids in pregnancy. Dr. McCarthy, how does fibroid affect women in general? I mean,
that's a good question, because you are recognizing the fact that it's not just the health challenges, yes, but even just the emotional challenge. In Ghana, when you mention fibroids, it's like, wow, what is going on with me? And so there's a very strong emotional reaction, psychological reaction to fibroids, and it can affect relationships, it can affect marriages, it can affect the person herself, sometimes just by knowing that she has them. Sometimes the symptoms can create a lot of problems. She's bleeding all the time, she's got excessive bleeding, she's got anemia, and so on. You know, so then it can have other effects ranging, can affect the heart, can affect the kidney, and so on through these secondary mechanisms. So yes, there are a lot of effects of the fibroid which go just beyond even just the physical factors. But then it also has the physical aspects where if it affects fertility, then that becomes another dimension. If it is creating a large mass in her tummy, she doesn't become comfortable and cannot function well in health. Also can affect issues of pregnancy. If she does get pregnant and the pregnancy is growing, there can be issues that are going on there.
Okay, so on that, could fibroids cause miscarriages? Probably a woman is having fibroid and she's pregnant. Can the fibroid cause her to miscarry?
Yes, yes. Fibroids are a cause of miscarriage. Depending on where they are located, if they are located close to where the pregnancy also is, they can be a contributory factor to miscarriage. There are some that are even preventing pregnancy in the first place. And then those are there also that cause miscarriages. And so yes, all this can happen. But a lot of the pregnancies will actually continue, and even in the presence of larger fibroids or multiple fibroids, the pregnancy can actually continue. And then other problems can then occur. Pain during the pregnancy, because there are a lot of hormones during pregnancy, and this make the fibroids grow faster, and then they start to undergo what we call degeneration and cause a lot of pain. They can also affect the placenta, especially if they are located just below the placenta or beneath the placenta. And so the placenta doesn't get the kind of blood flow that is required, and so that can affect the growth of the baby, or it can make the placenta separate from the uterus earlier than needed, and that can be very deadly, bleeding, death of baby, and so on. The presence of fibroids can affect pregnancy in terms of the location, especially if it is blocking delivery, or blocking the baby coming out naturally, or even at cesarean delivery.
Can fibroids regenerate after treatment?
Well, yes. I mean, it depends on what kind of treatment is happening. Even when you remove the uterine fibroids, new ones can continue to grow. I told you that the fibroids come about as a result of changes in the genetic nature of those muscle cells, and those muscle cells may still be there, but it's just that they haven't changed into the abnormal ones. And so new ones can grow. The ones that you remove will never come back because they are out, but new ones would start growing again. Yes.
So does fibroid affect means of delivery?
It could, especially if the fibroid is in the cervix, and that's where the baby is also going to go through. They can become a challenge. Or if during a cesarean delivery, the fibroid is sitting where you're going to do your cesarean delivery, it can be a problem. And so when it comes to delivery of patients who have uterine fibroids, one needs to plan even more carefully and decide how is this patient going to achieve a safe delivery and have that clear plan.
Okay, so I read somewhere that women with fibroid, if they undergo normal vaginal delivery, they tend to have issues with bleeding after birth. How true is that?
Yes, fibroids, especially if they are located in the endometrial section, could actually cause more bleeding at the end of delivery or after the placenta has come out. Even those that are not located at that point and are located in other sections of the uterus may reduce the ability of the uterus to contract properly, and that can cause a lot of bleeding. So yes, they are at higher risk of bleeding.
Okay, so let's take some questions from our viewers.
My name is Leonard Lewis Kwenu from Tamale. I want to ask the doctor, can fibroid regenerate after surgery or treatment?
I'm Kwe Priscilla from Amasaman district, and I want to ask doctor, why are fibroids not removed mostly during CS section?
My name is Abraham Ialbojo from Gomoa Obuasi. I want to ask the doctor, is infertility and fibroid the same?
Dr. McCarthy, one of our viewers wants to know what is the thing between fibroids and infertility?
There are quite a number of mechanisms where this happens, where it affects how the uterus contracts, how the uterus receives the embryo, how the health of the endometrium is, and all these have a negative impact on the ability to get pregnant. It also depends on the location and also the absolute size of the fibroids.
Okay, so our next viewer is asking, why are fibroids not mostly removed during a cesarean section?
That's interesting. A lot of ladies who say, oh, remove them as well. When you remove the baby, remove them as well. But we need to remember that during pregnancy, there's a lot of blood flowing to the uterus.
Okay.
And so removing fibroids also puts you at risk of excessive bleeding.
Wow.
And so you want to be cautious about that.
So this from our last view, I think you've answered this, but she wants to find out, will fibroid regenerate after surgery or treatment? Which I think you've answered
yes.
already. So we'll go for a short commercial break. When we come back, we'll look at some tips and doctor will give us his final words on fibroid. Welcome back. If you just joined us, it's still the pregnancy care show and we are looking at fibroid. So Dr. McCarthy, can you look into the camera, give our viewers any final words on fibroids?
Yes, so uterine fibroids are extremely common, but there is hope after fibroids, and one can still get pregnant with uterine fibroids and still go on to have a normal life. We individualize treatment for uterine fibroids and check to see what would be the best way to go. So there is hope even with fibroids.
So there is hope even with fibroids. Let's look at some tips on how to reduce fibroids. 1. Limit high sodium processed and packaged foods like salted canned meat, sausages, salted canned beans. Try to exercise frequently. Maintaining weight is also important. Avoid and reduce your intake or limit of alcohol. Eat more foods containing potassium like orange, banana, and coconut, and also limit your salt intake as well. Thank you for watching this week's episode. If you have any questions, if you have any comments, leave them in all our social media handles and keep subscribing to our YouTube channel. You can follow me personally on my IG page at @dede_gau. The show was brought to you by Flora Dish and Spetonic. See you next week.